Now we have a guest where I will have to go back to the English language again now.
Alexandra Sasha Latypova, are you with us?
Yes, hi Vivian.
Hello, nice to see you again.
Nice to see you.
Let me just say a few words to your background. So you're a pharmaceutical and medical device entrepreneur, and you have most of your professional experience in pharma and medical industries with specific focus on development, validation, regulatory acceptance, and commercialization of new clinical technologies. And you head the investigative group team Enigma. That sounds very mysterious, but yeah, so it's great. Maybe if you would like to add a few things to your background.
Yes, so I spent most of my career, I don't work full-time, although I work full-time for free now. I retired a few years ago from pharmaceutical research and development industry. And all this work is my independent work with my colleagues. I do have a lot of collaborators all over the world now. So my experience in pharma was in clinical trials, running clinical trials as a contractor for many pharma companies, including Pfizer. And so that's why I understand the regulatory requirements, what is expected by the regulators from something that is really approved as a safe and effective medicine, and definitely these products are not. And so that led me, that knowledge and understanding and seeing all these flagrant violations of regulatory frameworks all over the world, by the way, not just by FDA, but EMA in Europe, TGA in Australia, Health Canada, everywhere. So they all simultaneously violated all their own rules. And, that was very puzzling. So that led me to investigate this. And now I am also collaborating with the legal researcher, Catherine Watt, and a few other attorneys and, other people, data analysts. And, this kind of led us to build the complete picture of the crime as it's being committed, the pseudo-legal structure that they built for themselves, and how they're doing it, exactly who is doing it.
Mm-hmm. Yeah, fantastic. So we talked in a previous session about the evidence that points to the involvement of the military industrial complex, basically, and I think you have some new information on that topic as well.
Yes, I'm not sure how much of it is really, really new. I don't recall what we covered before, but yes, I can briefly walk through the, what's going on as far as the structure, and especially for those people who haven't heard the previous session. And I can answer some questions. And also, I believe I was asked to comment on this, Pfizer Gate, yes. Project Veritas.
That would be great as well. Wherever you would like to spend more time, because you are limited in your time options right now.
Yeah, so I can talk briefly about Project Veritas, as, since this is sort of just came up. I watched the videos. I watched also the follow-up, the reveal. And there are interesting things here. So in the first video, when this guy is bragging on the date about Pfizer, saying that Pfizer is mutating viruses that they're using, and when asked whether this is gain of function, he says, "Oh no, it's called directed evolution." I mean, they give different names to same things. And so it's directed evolution, and we're mutating viruses to predict what's going to happen, basically, and build vaccines for this. Now, when I heard that, I know this was very familiar language to me, because this is, by the way, I applaud Project Veritas for recording it like this, but it's actually not secret. It's plastered all over BARDA, DARPA, NIH, DOD, Industry Day. They present it publicly everywhere in all of their documents. Peter Daszak, Ralph Barrick, they use similar language. They all talk about this. So it's not secret at all. It's out in the public. You just have to pay attention. Now, why they're doing it? They're doing it to drive. This is part of propaganda and militarized propaganda, fifth generation warfare, where they extensively lie to people, drive them into fear with various techniques used by military intelligence. And very sophisticated, and obviously through capture of all the mainstream media, so that they can, mockingbird exercise, drive the same message. But it is propaganda. So it's designed to make people fearful and believe that there is, first of all, such a thing as, making viruses more lethal and more transmissible at the same time. And this is not possible to do. It's against the laws of nature. It's not possible to do this, but they want you to believe this. That's why they design all these things in media stories, all sorts of scientific clickbait that they put out. For example, I brought up example of more recently, maybe a few months ago, there was another, oh my God, Boston University is mutating viruses. Same thing. A study came out from Boston University saying that they've concocted this part of SARS-CoV-2 and this part of something else, and they put it together and they made a virus that killed 80% of the mice. Again, everybody lost their heads all over the place, were crying, oh my God, what are they doing? This is so dangerous. I assure nothing dangerous was produced in that Boston University study. What was dangerous is that propaganda clickbait that they made, seemingly prestigious university engaging in this. Wolfgang, you.